ready, guys?
Yes, sir.
You can start.
Before we start talking about the importance of malaria, let's talk like the WHO statistics shows us that every minute there's a child under 5 who dies from malaria in Africa. So before that, I'd like to introduce myself. I'm Prajay from first year LA2-223. This is my colleagues Tanish Kodi and Pawan Raj. Before we'll see a small video representing malaria, how it is transmitted. Now we'll talk about why we need to talk about malaria, because why it's so important. There are
You need to read from slides.
yes, ma'am. No.
You can to move.
You can move.
Little move. This.
No, ma'am.
This.
See, around the globe there are 195 countries, ma'am. In that 195 countries, there are 85 countries which is malaria epidemic. In that 85 countries, 29 countries are very much affected by malaria, ma'am. We can see 95% of these countries are located in Africa. The red color that we are seeing is mostly affected countries in Africa that are most people die from here, and most people are affected from these regions. Yellow regions are countries that are mildly affected, and the blue color regions are areas where we can't see any malaria epidemic. And this we also can see that in 2019 we can see 227 million cases were reported over malaria. These cases were jumped to 241 million in 2020. So we can see a rise in malaria cases. Also we can see a rise in malaria death. From 2019 it was around 619,000 deaths reported from malaria. And from 2022 we can see 647 cases. That's 12% of the increase in death rate in malaria. When we talk about India, is that India accounts to 1.7% of the global malaria cases and 1.2% of the malaria's death rate. We also can see the chart representing number of percentage of countries that are affected by malaria. 95% of the cases are reported from African countries, 1.7 from India, and others are 3.2. When we look at the malaria distribution chart by chart, we can see most of the countries, 49% of the countries are not affected by malaria, and we also can see 13% is heavily affected by malaria, and 37.9% are mildly affected from malaria. We also can see the decreasing number of rate, but this is in the global. This is a global chart, ma'am. But we can see increase in number of cases in African country. This chart represents like blood side microscopy, the diagnostic method, microscopy method is being reduced, and we can see the increase in number of RDT, new test, modern test.
Good morning. Now we are going to see that the diagnosis. First method.
Since 1 minute. Students, now we listen to report. Why? We listen to other students' voices, yes? So you should attentively listen to report.
The diagnosis method will be explained
Good morning. First method is a microscopy. This is a traditional method in which the blood samples of thick and thin smears are taken. In the thick smears we can easily identify what plasmodium it is. Then in thin smear we can see the species of malaria or vivax or falciparum or ovale. There are shapes of that microscope. In malaria we can see this shaped parasite. In vivax and ovale we can see the oval shape. It's difficult to distinguish between Plasmodium vivax and Plasmodium ovale. In falciparum we can see one ring structure. Next one. The next step is the antigen detection. We can use RDT cassette. RDT cassette is equipment used to identify the malaria. It's called rapid diagnosis test. We can take some blood samples of infected persons and we can see which type of Plasmodium is transmitted.
That's why I told to escape.
Которые позволяют выявить
Good morning to everyone. Now we will see about the treatment. We want to know about we want to know about some points for our treatment. First of all, what infected Plasmodium species is available. Then the clinical status of the patient and previous use of anti-malarials. For pregnant woman diagnosed with the uncomplicated malaria, which is caused by the Plasmodium malaria and Plasmodium ovale, chloroquine sensitive Plasmodium vivax or chloroquine sensitive Plasmodium falciparum infection, which is promoted by treatment of chloroquine or hydroxychloroquine, which is recommended one of the recommended treatment, and we can use additionally oximeter lumefantrine and quinine plus clindamycin given in still. Now we will see about severe malaria. Severe malaria can progress here fatal outcome of fertility. Severe malaria means we want to initially start our treatment and patients with severe malaria regularly regardless of infecting species, we can use chloroquine or hydroxychloroquine is one of the recommended process. Next. Next one we will see about serology. Serology is one of the method of diagnosis, and serology is used to detect the antibodies of the parasite and which is not suitable for diagnosis. And this method have a valuable research tools and may be useful in low prevalence areas, marking low prevalence areas by mapping submicroscopic infections. And this can assist in the development of more targeted intravenous contributing to malarial elimination. And serology has been employed in the recent past years. It is used to identifying the markers of Plasmodium vivax exposure, and it is used to determine the linkage with the risk of relapse, and could form the basis of indirect hypozonic detection test. This point is about our PCR technique of malaria. Now we will
Next slide. The reason why we are talking about PCR the last is that it's a very important topic, and it's a modern diagnostic method where you can find malaria very easily. And before that, I want to give you a small example of that. PCR we need only 1 to 5 parasites per microliters. Whereas if we look at microscopy or RDT test, microscopy requires 50 to 500 parasites present in microliters, and RDT requires minimum of 100 parasites which is present in microliters. So if you are looking at PCR, it's very with less number of parasites we can identify which diseases are there and which parasites. So now let's look at what is PCR. PCR is a polymerase chain reaction in which you can multiply the number of DNA by millions or billions, and if you are looking into PCR, it's modern technology which is used, and PCR is nothing but if you are taking a small piece of synthetic DNA, it's called as primase, and if you make it replicate it and use it finding the DNA of the parasites and genomic type of the parasites, we can identify which parasites is affecting it. The both slide. This is a common use common meaning of PCR, and previously what we saw is the importance of PCR in malarian diagnosis. Next slide. Thank you. Any question?
Yes, yes. Will not make this. Yes. Second question. No. Very interesting info about PCR. Tell how this is PCR analysis distribution in India. It is possible to make for every case of malaria, or it is only a high development center?
Actually, PCR is a very costly method, ma'am. So most of the underdeveloped countries or developing countries can't prefer PCR, ma'am. But the reason why we can prefer PCR is that it has like, you can identify less parasite, ma'am. If you have a less parasite in the blood, you can identify easily which parasite is affecting. It's like 100% rate, ma'am. When we saw an article in which 1,700 cases reported in African nation, ma'am. But Africa can't afford PCR, ma'am, because it's an underdeveloped country. But the scientific research people are telling us that if we prefer PCR, it's only for the developed countries. Now, they are switching to RDT, ma'am, because RDT is cheap, but it's low sensitivity, ma'am. But it has a good rate, ma'am, compared to microscopy. Microscopy requires a high level of seeing, ma'am, because as he said, ovule and vivax, ma'am, parasite, they both look the same, ma'am, like oval in shape, ma'am. So it requires a hard lab technicians, ma'am. So PCR, if you are talking about PCR, yeah, PCR is very difficult to afford, ma'am. But most probably in future we can do PCR.
I hope that in future, because we start to also work in genetic engineering, in our students also can to make this PCR analysis step by step, but it may be not full complete in was previously, but I hope that in future your course and next will make it very easy, because in real PCR it is not very difficult. This is 6 students which can to make it and do it. Yes, difficult. You answered very fast. I sometimes understand, sometimes not understand. So I will repeat my questions. It means in Africa cannot possibility for make PCR.
Yes, ma'am. African.
India has, but you said that it is difficult and not very wide
Yes, ma'am.
for all area. But what info they give PCR if we say for malaria we can to understand look on patients. We understand it is malaria present. You show for us blood, and we also can to find this is erythrocytes with plasmodium. It is to give for us information about disease. We also can to from your report information about antibody present or not. What we want to understand or find when we will make PCR. What it is new info for patients or for doctor?
PCR method. ma'am.
Yes, after PCR analysis.
After PCR analysis, we'll get to know 2 things, ma'am. Which parasite is attacking and which species of parasite is attacking the patients, ma'am. The thing is that in
Only
other
slowly.
the thing is that in other method also we can find, ma'am, but the process is long, ma'am. PCR is a new modern technology. With less amount of time we can identify easily, ma'am. But now in India, it's like some places are affording PCR, ma'am. Like most of the places are not affording, ma'am. But for me, ma'am, like for our team, ma'am, we guess like PCR is the best method for malaria diagnosis right now. It can bring a revolution in genetic research also, ma'am.
For research also,
Yes,
yes.
ma'am.
And maybe for treatment, very important to know which species
Species, ma'am,
of
yes, ma'am.
species of plasmodium.
Even though we can identify the species in in microscopy, ma'am, method, but it's very difficult, ma'am. If we compare with ovule and vivax plasmodium, they both are in same shape, ma'am, oval in shape. So we need a very high level of technicians, ma'am, lab technicians to identify this. But it's easy now, ma'am, because of PCR method, ma'am. We can easily identify which species are there without
But
any involving lab.
to go inside PCR, it is high cost to go inside
yes, sir.
PCR, but after is cheaper, and low cost is, I guess this is microscopy, yes?
Yes,
But
sir,
it's
low
too
cost
hard,
microscope.
too slow and too hard.
Yes, sir.
PCR is low cost after, but before. We need to
Sir.
buy one, second, third,
Yeah,
they're very
sir,
high.
if you are looking at microscopy, sir, like
Mm.
we need a lot of lab technicians. Everyone should view it, sir, because
We need
like,
only microscope, the laboratory worker,
Yes,
yes,
sir.
and glasses, just it.
Yes,
Ah,
sir.
and colors.
Stain.
But in PCR we can like identify like hundreds of patients. Like with microscopy takes time, sir.
We
it
just
takes time.
we just
PCR
can get.
also take time.
But
But maybe
compared to
here
others-
we can to find info about gene of treatment resistation. Yes?
yes.
And one step it is understand what species. Second, understand will work our treatment or not. Because I think this is treatment, drugs also very toxic. Yes, and give not excellent effect in high dose. Okay, have any questions? No? Yes.
What is the best treatment for malaria?
It depends on the cost efficiency. Like, if you want like little cost, you can go for microscopy method. That is also called as golden effective method. Okay. If you want like immediately like good results and all, it's like PCR. We can afford PCR.
The question was about treatment.
Question was about treatment, not about
Question was
diagnosis.
about
Treatment.
Yes.
Treatment. Most of the treatment, like if you are talking about treatment, people go for hydrochloroquine or chloroquine, which is like easily affordable. Like most of like pregnant, all the people can use it. Pregnant, children, and like so looking at the treatment, it's very specific for like pregnant women. We are giving specific drugs for children. We are giving, but these two drugs we can give to all the patients.
The actually treatment is depend from diagnosis, yes?
Yes, sir.
If we correctly diagnose, we can, treatment is successful. Okay, thank you.
Thank you, sir.
Any more questions? No?
Thank you
Okay,
very
thank you
much.
very much.